everyone, I'm Dr. Ushna Naveed. Welcome back to my channel. I am from AMC Smart Prep platform. This platform is providing you a summarized group of all you need for the preparation of your AMC. That's a paid group, and you can join in the WhatsApp and the Telegram, whatever you need, and you can email me if you want further details about the group. So, today we are talking about the Red Book, very important source of your screenings for your AMC exam. Screening is a very important part of your public health, and public health is that topic that helps you get so much score in your AMC. There are certain topics which you know it, and you will perform excellent in your exam. So screening are one of them. This is the QR code you can screen to join the WhatsApp group to be updated with updated guidelines and whatever the resources of the AMC is. You can also get the therapeutic guidelines. Many files are uploaded in the Telegram group and the WhatsApp group free of cost. So this is about the Red Book. This is how the Red Book looks like. You can easily find the Red Book on the Google. Just write the Red Book RACGP and you will find this beautiful Red Book online that is available. No need to purchase that book. Currently, we are following 10th edition. This is the updated edition. And among the Red Book, when you open the Red Book, this is the index. There are many topics, but you do not need to cover whole of the Red Book. That is not important for your exam. The most important priority which you should focus upon is the cancer. Okay, do not get confused, do not get feared by just looking at the list of the cancers. Not every cancer is important for you guys. The most important cancers which you have to cover, must to do from the Red Book, is the breast cancer, cervical cancer, and your colorectal cancer. You can say these are part and parcel of your AMC preparation. Many a times in your single attempt, like day one, day two, you can get 3 or 4 questions of the same screening, same cancer. So that is a possibility, that many good scoring chance of just by doing these 3 to 4 topics. Then comes the lung cancer. Among the lung cancer, the important thing is that there are just 3 4 questions AMC loves to ask, that there is no routine screening of the lung cancer. Mostly we do not perform lung cancer screening as a routine performance. Then the second important thing they ask about smoking cessation. Okay, so smoking is a very important factor for your development of the lung cancer, and for the prevention of the lung cancer you have to stop smoking. This is an MCQ. Then the third MCQ, they love to ask about the screening of the lung cancer, how you're going to screen the lung cancer. So CT scan is required for the screening of the lung cancer. So far, these 3 questions has been repeatedly tested in the AMC exam, not much from the lung cancer. And definitively you should know about the age at which you start the screening for any kind of cancer. That is extremely important, because if you know the age, then you are going to apply the knowledge. Then the other cancers which are mentioned here, not extremely important, but just have a look about your prostate cancer, just a basic concept from the Red Book. And the skin cancer. The skin cancer, surprisingly, that is not written very beautifully in the Red Book. You have to cover the skin cancers from the RACGP guideline. There is an article of related the melanoma in the skin cancer. So whenever you open the RACGP guideline, any guideline for any topic, that's so easy to search from the Google. Just write the melanoma screening and RACGP, then you can easily find your that guideline from Google, that is online available. But whenever you read the article, be sure that you are reading the updated article, because in when you write this RSCTP, all the related articles, the old one, the previous one, they are going to be opened, and you have to make sure that you are reading the updated version. So this is very important. Skin cancer, but the three must to do cancers is the breast, cervical, and colorectal cancer. The other aspect of your Red Book that is very important, that is not anywhere, like any source you cannot find this topic, the cardiovascular risk screening. So this is also a very favorite topic of AMC. They love to ask about the cardiovascular screening, and they love to ask about the risk stratification tool. What are the categories in which you have to screen, like risk factors, mild, moderate, severe. So this is very important. And among of these, the very favorite question of AMC is that whenever you have high risk of cardiovascular screening, we do not go for the cardiovascular risk assessment tool. This has been repeatedly come in your exam as such. Other topics you do not need to do from the Red Book, like atrial fibrillation, kidney, you do not want to go into the depth of the topic. Now this is very important. This is not from Red Book. Actually, this you can open directly from the Google. This is from Australian guidelines. You just open the Victoria guidelines or the National Immunization Program. Write this National Immunization Program on the Google, and you can directly find this flowchart. There is a big flowchart also, but this is summarized one. So have a look at the flowchart and everything you need to do about immunization. One aspect is covered here, but obviously there is a big flow chart which covers aboriginal immunization, catch-up immunization. So you need to cover those topics as well. So immunization and screening, trust me, these are the most important scoring topic of your public health domain of the AMC. And public health is a very important essential component of your AMC preparation. These are different topics which you cannot miss. These are very important for your exam, which is national screening program: cervical cancer, breast cancer, bowel cancer. And you know, you do not need to go for every word to word reading of these cancers from the Red Book, even from any other sources. The most important thing is the flowchart. Whenever you read any kind of guideline, be particular about the flowchart are extremely important. But if you are not able to make the concept, then you go through the reading of your text. That is not mandatory to repeat again and again. In the national immunization program, so you should be familiar about the childhood vaccination schedule, catch-up immunization, special risk groups. Like very important one is this pregnancy related or splenectomy related immunization. They love to ask about pregnancy related immunization. And then there are certain contraindications of that immunization, like let's say for example, if you are giving the immunization of the hepatitis or you are starting a biologics to the patient, you have to screen for the TB, or in certain immunizations you have to check for the immune status of the patient before giving the live attenuated vaccine. So this is the important basic concepts regarding immunization. So be familiar with all these topics to have a very good score in your exam. These are the links I have attached. The links are also available in the description box of the channel. You can just directly click the link and join the Telegram group and the WhatsApp group for your preparation. And this is the barcode for scanning of joining the WhatsApp group. So this is basically AMC Smart Prep platform, and you can just join, or you can comment in the comment section if you want some specific discussion regarding any topic. I have uploaded different topics: ECG interpretation, CT scans, X-rays, everything is available on the channel. So join the channel, which is Dermatology Mnemonics plus AMC. And AMC Smart Prep is basically the Telegram and WhatsApp platform. Okay, so Dermatology Mnemonics is the YouTube channel. Thank you so much.